Today's a day. It has been 1 week, one miserable week of having my septoplasty as well as the Inspire sleep apnea implant. So today is my 1 week follow-up. Leaving momentarily to head out there for this specific follow-up. It's to take out the stents that are inside my nose right now, which you can still hear. I'm still pretty congested, or mildly congested at this point. I'm just putting on my final bandage before I go. So very excited to get to the doctor's office and to get these stents out. They'll also check on my Inspire incisions. So you can see here, my neck, this is 1 week after. I've been fighting with bandages for the last 2 or 3 days. It has been a struggle to keep a bandage on because of a couple reasons. It is really just the talking and the chewing that I'm doing now. There's just so much more movement around there. But also, I think kind of the main culprit here is the hair. As you can see, I have not shaved in a week. So there's a lot of hair coming through, a lot of facial hair coming through. And that's really the main issue. I feel like it just continues to not be as strong as it needs to be. And so I'm really struggling with keeping this on, and it needs to stay on, right? I was told it needs to stay on because it needs to stay dry and heal and all of that, which great, but nobody really told me, hey, facial hair may be an issue, and it has been. So I have to change these a couple times a day, not because they're bloody or bandaged or anything like that. The bandage is bloodied, it's because they continue just to fall off. So I had to go, buy these surgical grade sticky bandages, which are $15 a pop for 5. And I've gone through like one a day, one and a half a day. So, but regardless, we are in the home stretch of follow-up. So I will, be very excited when this day, when this appointment is over. And I'm going to try to capture some of the process while I go there. You can see I'm raising my arm a little bit, which just chest and pec wise, it has been good. So I'm happy about that. Just being able to move. And even chew. I was able to chew a little bit more of my breakfast this morning. So very happy with kind of, the improvements and the recovery so far. So off we go to the doctor's.
Is that up for me?
Yep.
One, two. Done.
Okay, just got out of my 1 week follow-up with the ENT's office. Everything went really well. Just wanted to give my first reactions of having those stents out from the Septoplasty. So I think immediately you just obviously get a lot of oxygen, a lot of air going through. She did mention that, there was potential for a weird smell that she's like, that just might be, dry blood. So far, don't have any of that. There was a little bit of cleaning that she had to do prior and after, but overall she said that I kept it pretty clean, which was good to hear. And there was one little thing that she had to take out, a little incision or stitch, that she had to take out. Again, that wasn't painful at all. Entire procedure, took seconds, and it didn't hurt at all. It was, if anything, obviously a relief. She said I'll still be a little congested, obviously, as I'm still swollen, so there is still time to heal. She said really it's going to be a few months before it's full. I'll definitely start feeling relief more so in the first month, but she said it could take up to 3 months to feel quote unquote normal. But right now I just feel amazing being able to breathe. She then checked on obviously my Inspire incisions. She said that everything looks really well and really good, which I'm like, okay. So she removed this bandage. She said I don't need it anymore. She took off my chest bandage as well. She said everything looks great. She said everything, I shared all of my experiences and the feelings and the pains and discomforts that I've been having. She said all, obviously perfectly normal. And that, now I just kind of need to heal and until I activate in about 3 weeks with that doctor. In terms of working out, she asked me what I do. I said, hey, I do a mix of stuff, powerlifting, CrossFit, things like that. So she said, you might want to wait another 2 weeks. She's like, definitely you can begin doing some light stuff, cardio, light weights, kind of just build up in the next week or two to your base level. She said to keep moving, both moving your neck, moving my arm and chest area. She said you don't want anything to go stiff, so making sure that there is movement. She said, but if you feel any type of tug or pull, she said, just stop. That's your body just telling you, you're not ready for that just yet. So she's like, but definitely do movement and just listen to your body overall in terms of what you can and cannot do. So overall, it was a really good appointment. She said I'll have to use this for the next couple of weeks, 3 times a day. She gave me some directions. I'll have to look through it a little bit deeper, and continue this for a while. So I'm looking forward to actually eating some food and being able to taste it, because that's been really difficult. Again, with my entire Inspire, incision here on my neck, it's been difficult to chew anyway. But also not being able to taste the food because of my nose being clogged up. Food has just not been the greatest thing, which I usually enjoy. I'm down about 5 to 7 pounds. But now that I have the stents out, I hope to, even I'm eating some soup or whatever, at least being able to taste it a little bit more. So I'm really excited for that. And just being able to breathe. I think overall, it feels weird to have so much air rushing in, knowing that I'll still even have more as the swelling continues to go down. So really happy with where I'm at right now. And now kind of the next step is really looking at healing for activation, but also I'm going to look at, getting back to some type of working out and training and building that up slowly, which I'll find really hard to do. But again, listening to my body, I'll have to just make sure I do what I can and just start small and kind of rebuild. So really excited about that. And I think that's about it.